Welcome to the Plain English Public Health Weekly Report. I'm Richard Greenland, and today is October 30th, 2020. As always, we start with our COVID-19 statistics. Worldwide, we have nearly 46 million cases and nearly 1.2 million deaths. In the United States, we have over 9.2 million cases and over 235,000 deaths. Lots of studies were released this week that reinforce what we've been saying for quite a while now. So let's start with those. A study tracked the rate of new COVID-19 infections in Kansas, comparing counties with mask mandates to those without. It found that counties with mask mandates had half the rate of those without. Though there could be other reasons for the disparity, it's highly unlikely that a difference that large is a coincidence. Masks work. We talked a couple of weeks ago about how long immunity to COVID-19 lasts. We pointed out that most research shows that immunity only lasts a short time, though there have been a couple of studies that have shown longer immunity. This week we got results from more studies, including one that was very large, and all those confirmed that immunity doesn't last very long, just a few months. So this is another nail in the coffin of the terrible idea to rely solely on herd immunity. Another study showed that brain fog that many people with COVID-19 report is not an illusion. The study found that those who were considered recovered from COVID-19 had mental deficits that were the equivalent of dropping an average of 8.5 IQ points or having the brain age 10 years. Since most people don't take cognitive tests on a regular basis, they weren't able to compare the actual patient's cognitive abilities before and after COVID, but they did compare them to similar groups of people who had not been infected. Those who had the most severe COVID-19 symptoms also had the biggest drop in cognitive ability, but even those with mild to no symptoms experienced some loss of ability. Researchers don't know if this mental decline is permanent or temporary. That's just another one of those symptoms that, it's not about death. Sure, death is terrible and everything, but that's not the only thing that COVID does. Even if the death rate were to drop below the flu, all these other things would still make it more dangerous than the flu. A CDC survey found that mask wearing is increasing throughout the United States, but some areas of the country are much worse than others, and those between the ages of 18 and 29 are particularly lax about wearing masks. A new study found that the people most likely to believe in conspiracy theories about COVID-19 and dismiss science-based guidelines were those who had the most trouble with numeracy tests. Now, numeracy tests measure a person's ability to understand and use quantitative information. In other words, those who can wrap their head around percents and numbers and apply them to the world around them, those are the ones that tend to follow the guidelines best. They do the best on numeracy tests, and they tend to believe the science. If you've been struggling with determining which social media posts are true and which are fake, try a new online game sponsored in part by the World Health Organization that teaches you how to tell the difference. You can find the game at goviralgame.com. Another study found that countries with poor overall hygiene and low quality water sources have lower COVID-19 fatality rates. The researchers aren't sure exactly why that is, but they believe that the people who live in those countries are most likely already used to taking the extra steps necessary to keep themselves healthy, just because of the lack of the good water and the regular hygiene practices. In more developed countries, though, we're used to it being clean, and so we're not used to doing all the different things to keep our hygiene up because we just expect everything to be clean. When a new virus comes along, like COVID-19, however, things change quickly. So we need to stay diligent about our personal hygiene, especially washing our hands. Over the last month, the United States has seen a 46% increase in hospitalizations due to COVID-19. Some areas are much worse than others, and hospitals are running out of room. Thankfully, death rates are lower due to better options with the care, but that could change if patients aren't able to get that care because of a lack of equipment or staff at hospitals. This past week has also produced new records for cases in the United States. At this point, no states are seeing a continuous downward trend in cases. Most are seeing record or near record increases. Due to the surges in cases and hospitalizations, many states and cities are increasing restrictions. Here's a few examples. Fargo, North Dakota, and Ozark, Missouri, among many others, have implemented mask mandates. Idaho has returned to previous restrictions on bars and restaurants, and many cities, including Chicago and Newark, New Jersey, have imposed curfews. More bad news is that the antibody treatments being developed by Eli Lilly and Regeneron have both been shown to either not work or to not quite be safe enough for patients who have severe symptoms. Research is still ongoing for those with milder symptoms. So what good news do we have? Well, there's a few. First off, Google is rolling out a feature in its Maps app that will show on the map itself how busy businesses and other public locations are. Previously, you could find that information, but only if you did a separate Google search. Knowing how busy a place is can help in planning trips to avoid crowds during the pandemic. Cloth face masks could soon have labels that show how effective they are. ASTM International, an organization that sets many technical standards, is currently working on ways to test and certify cloth masks. Labeling will be voluntary, but those mask manufacturers who choose to take the extra steps to become certified will be able to officially boast of their efficiency, which will hopefully increase their sales and should definitely help us have more confidence in cloth masks. A couple of new options for masks should be available soon. One option being developed uses heat to destroy the virus as it filters through the mask. Another option uses human-safe chemicals to do the same. And also, taking daily low-dose aspirin seems to help reduce the risk of death and serious complications from COVID-19. Researchers believe that aspirin's blood-thinning effects are probably the main reason for the reduced risk. As with any medication, please speak with your doctor before starting a daily low-dose aspirin regimen. Other news this week includes a recall for deli meat due to Listeria. There have already been 10 hospitalizations and 1 death due to this outbreak. So far, it only seems to be Italian-style deli meats, and only in New York, Florida, and Massachusetts. But the CDC is recommending that at-risk groups, such as newborns, adults over 65, and those who have compromised immune systems, avoid eating any type of deli meat unless it's been heated to over 165 degrees Fahrenheit. No specific brand has been identified, so just be careful with all deli meats. Another bit of good news, the first nest of murder hornets has been destroyed in the United States. Scientists were able to tag some hornets with radio trackers a few weeks ago, and were finally able to find the nest at the end of last week and destroy it this week. They do expect that there are more nests, and they will continue to search for them. Finally, a couple of nutrition items. First off, researchers have found that diet drinks sweetened with artificial sweeteners are just as bad for heart disease as sugar-sweetened beverages. We've known for quite a while that diet drinks don't actually help people lose weight, but now we know that they can also cause harm. The best option is to avoid sweetened drinks altogether, whether that's sugar-sweetened or artificially sweetened. Water should really be everyone's go-to drink. It's the healthiest drink out there. But if you need something sweet to drink, then naturally sweet drinks with no added sugar or artificial sweeteners, such as 100% juice, would be your best option. Another study has shown that a diet high in sugar causes a change in gut bacteria that makes them produce chemicals which eat away at the large intestine's mucus layer. That can cause inflammatory bowel disease and other gastrointestinal issues. So please don't go crazy with sugary food or drinks. Thank you for watching the Plain English Public Health Weekly Report for October 30th, 2020. As always, you can check the links below for any more information about stuff that we either didn't get to today or more information about the stuff we did talk about. I'm Richard Greenland, and you have a happy and healthy Halloween weekend.